this video, we will cover various developmental anomalies of the jaws. We'll cover Agnathia and Micrognathia in this video. So, what is Agnathia? It is basically the hypoplasia or the absence of mandible or maxilla with dispositioned or basically abnormally positioned and deformed ears. Now, important point to remember here is that it is autosomal recessive mode. Autosomal recessive mode of inheritance. Now, coming on to the some other names, it is also called as holoprosencephaly, or it is also called as autocephaly. Now, what we see is basically the entire jaw is not missing most commonly. Most commonly, only one portion of the jaw is missing. So, in case of maxilla, it is mostly premaxilla, and in case of mandible, it is usually the condyle region or the ramus. Now, this occurs because of the failure of migration of neural crests mesenchyme into the maxillary prominence in the fourth and fifth week of gestation. In fourth and fifth week of gestation. Okay. Now it has very poor prognosis and it is very lethal anomaly. Now coming on to the micrognathia. Now in micrognathia, as the name suggests, what we will see is there will be hypoplasia. So basically, there will be the jaw that will be unusually smaller. Now the causes are you can remember the causes by an acronym as HUM-T. Now remember that T will come three times. Okay, so H stands for Hallerman Streiff syndrome, M stands for Marfan syndrome, P stands for Pierre Robin syndrome, T stands for Turner syndrome, another T stands for trisomy 13, and another stands for trisomy 18. Now, there are various types of micrognathia. One is the true micrognathia, and the another one is the pseudo or the false micrognathia. Now, in true micrognathia, we further have two types. One is congenital, and the another one is acquired. Now, in congenital, basically, it will be linked to certain syndromes. So basically it will be related to the Pierre-Robin syndrome. In this, what we see is that there is a in case of maxilla, what we will see is there is an absence of premaxilla. So basically there will be the person's middle third of face, it will be retracted. Whereas in case of mandible, what we get to see is that there is a retrusion of the chin because of the genesis of the condyle, Now in case of acquired, what you will see is you will see around three features. The first one being the retrusion of the chin, then a steep mandibular angle, deficient chin button. Now this will basically be postnatally, as the name tells us. Now why is this happening is because of some trauma to the TMJ, like ankylosis. Now this covers Agnathia and Micrognathia. Next video we'll discuss Macrognathia.